So I have a great question for you, Dr. Kim, in regards to toxicity. One of our patients has heard that development of side effects is sometimes associated with better survival, actually. So therefore, if someone is experiencing no side effects, but is also not having a great response to treatment, should we be perhaps increasing the dose of their therapy? What are your thoughts there?
Yeah, it's a very good question, and one of the questions that I get asked a lot sometimes. And my experience has been that, and there are some studies showing that if you develop rash on EGFR inhibitor therapy, there may be some better survival or outcomes. Those studies may be sort of limited by some of the survival bias that because if you develop a certain side effect, you may have to live certain period of time to develop that, and so it is important to, when we assess those studies, it is important to assess whether they did any statistical analysis or design to correct that bias, the survival bias. And in terms of immunotherapy, I think there's probably a little stronger data to suggest that if you develop the vitiligo or rash on some immune checkpoint inhibitor therapy, there may be stronger survival. In the setting of targeted therapy, I'm not quite clear actually whether there's any sort of conclusive statements because I have seen many patients who have not had any side effects or just minimal side effects who did very, very well over time. I had some patients who had developed really bad side effects at the same time, didn't respond well, as you mentioned. And so making the correlation, I think, is somewhat tough. There may be some suggestion or association, but it's not a strong one.